head and neck, we have studied the face, scalp, and we have studied the oral cavity, we have studied the orbit, the nose, and the vestibular apparatus, and we have studied the neck. Now today we will study the blood supply of head and neck. Although we have studied regionally with every part we have studied, but here we will study it in common as a whole. Now the blood supply of head and neck. The arterial supply, but delta slide is number 2 now, is from common carotid arteries, from 2 arteries, one on each side, ascending from the thorax into the neck and supplying the neck and the head. These are the 2 common carotid arteries, right and left common carotid arteries. The left and right common carotid arteries are the same, but their origin differs in the thorax. The left common carotid arises from arch of aorta in the superior mediastinum, while the right one arises from the ascending aorta. Now here is the slide number 6 to show the common carotid artery on the right side. The left common carotid artery arises from the arch of the aorta, ascend in the neck directly into the neck separately behind the left sternoclavicular joint. The right one, the right common carotid artery, which is this one in this slide, this arises from the brachiocephalic trunk. The brachiocephalic trunk arises from the arch of the aorta on the right side, in the thorax, in superior mediastinum, ascend upward behind the right sternoclavicular joint, divides into 2 branches, into right subclavian artery, which is this one, right subclavian artery, and right common carotid artery. Then the 2 common carotid arteries, they have the same course in the neck. So they start from the left one start directly from the thorax, ascending from the arch of the aorta as a separate branch, while the right one arises behind right sternoclavicular joint as a branch of brachiocephalic trunk. From behind the sternoclavicular joint, both right and left common carotids, they pass upward into the neck. They enter inside the carotid sheath. If you remember the carotid sheath, they enter in the carotid sheath of the neck, accompanied by the internal jugular vein and the vagus nerve between and behind them, with the internal jugular lying to the left of it. These two common carotid arteries, they ascend in the carotid sheath till the level of superior border of thyroid cartilage, till superior border of thyroid cartilage, where each of them divides into 2 terminal branches. You see here, this is the level of superior border of thyroid cartilage. The common carotid artery divides into 2 branches, into external carotid artery and internal carotid artery in the carotid triangle. Both of them, they have no branch in the neck. They ascend upward till level of superior border of thyroid cartilage. The 2 divide into 2 branches, into external carotid and internal carotid artery. The internal carotid artery, this is the smaller of the 2 branches, ascends continue inside the carotid sheath until it reaches to the base of the skull, where it enters through the carotid canal to pass inside cranial cavity. This is for the supply of the brain. Most of the brain is supplied by the internal carotid artery. Again, the internal carotid artery has no branch in the neck until it passes into the carotid canal. This is for the supply of the brain and the contents of cranial cavity. What remains for the supply of the head and neck is the external carotid artery. So the arterial supply of head and neck from common carotids, right and left common carotid artery arises from the arch of the aorta and superior mediastinum of the thorax, ascend behind sternoclavicular joint into the neck by entering in the carotid sheath. The right one arises from the brachiocephalic artery behind the right sternoclavicular joint, ascending into neck to enter in carotid sheath. Both common carotid arteries, right and left, ascend in carotid sheath medial to the internal jugular vein, reaching to level of superior border of thyroid cartilage. Each terminate by dividing into external and internal carotid arteries. They have no branch except that they terminate by dividing into external and internal. These are, as I said, the source of blood supply to head and neck, most of the brain and meninges. The internal carotid, the smaller of the two branches, extend upward in the carotid sheath, medial to internal jugular vein to reach base of the skull, to enter carotid canal of petrostemporal bone, passing inside cavernous sinus, and then emerge behind the anterior clinoid process to divide into middle and anterior cerebral arteries. As I said, this is for the supply of the brain. We will leave this. We have nothing to do with it because it doesn't give branch now before it enters in cranial cavity, any branch to the head and neck except inside the cranial cavity. And the main supply is the external carotid artery, the largest of the two branches. This leaves the carotid sheath in the carotid triangle. It leaves the carotid sheath while the internal carotid remains inside it, ascend to behind in the carotid triangle, behind the angle of the mandible, and then behind the ramus, it enters inside the parotid gland here. The parotid gland has been removed, which lies anterior to the masseter. You see the part of the mandible also removed with the parotid gland to see the external carotid ending inside the parotid gland by dividing into maxillary artery and superficial temporal artery, two terminal branches. So the course of the external carotid artery starts from the carotid triangle as the largest of the two terminal branches of the common carotid artery, ascend upward, leaving the carotid triangle to behind the angle of the mandible, and then winds around the posterior border of the mandible, ramus of mandible, to enter inside the parotid gland, and within the parotid gland divides into two terminal branches. If you remember, these are non-glandular structures within the parotid gland. The terminal portion of external carotid and its two terminal branches, the superficial temporal and maxillary artery. So the external carotid artery is the largest of the two branches, leaves carotid sheath to enter in carotid triangle, ascending toward angle of mandible, passes in the posteromedial surface of parotid gland, enters within it, and terminates by dividing into maxillary and superficial temporal arteries. You can feel the pulsations of the external carotid and common carotid in the carotid triangle, just in level with the superior border of thyroid cartilage. If you press your finger there anterior to the sternocleidomastoid muscle, then you can feel the pulsations of the carotid arteries. Now, the external carotid artery, as I said, is the main supply to most of the neck, face, and scalp. All the structures in the head and neck, except the brain, of course, which is supplied by internal carotid. To do this, the external carotid artery gives rise to a number of branches before it enters inside the parotid gland for the supply of structures in the head and neck, and we have seen most of them. Now, the first branch given from the external carotid artery is the superior thyroid artery. This one, the first one, is the superior thyroid artery. If you remember the superior thyroid artery, we have studied it with the thyroid gland and with the larynx. The superior thyroid artery arises from the medial aspect of the beginning of the external carotid artery within the carotid triangle. It descends toward the superior pole of the thyroid lobe, where it divides into anterior and posterior branch. The anterior branch pass along the superior border toward the isthmus to anastomose with its fellow, and the posterior one descend downward on the posterior border of the thyroid lobe to anastomose with a branch from the inferior thyroid artery. This gives rise also to the external superior laryngeal artery for the supply of the structures of the larynx, and gives rise to a branch to the sternocleidomastoid and to the hyoid bone. So the first branch of the external carotid is the superior thyroid artery, supplying the thyroid gland, part of the larynx and sternocleidomastoid and the infrahyoid muscles. Next, the second branch of the external carotid artery is the lingual artery. The lingual artery also arises from the anterior aspect. The lingual artery. Here is the external carotid artery in this slide number 7. The first branch, which is cut now, is the superior thyroid. Next, we have the lingual artery. Now, the lingual artery, again, we have studied it with the tongue. The lingual artery is the main supply of the tongue and floor of the oral cavity. That has a tortuous course. You see the course of it is tortuous, is not straight. This is to allow for the movements of the tongue, because it becomes stretched, and if it is straight, then it becomes torn and lead to bleeding. So it has a tortuous course, so that when the tongue moves, it pulls with it, and then it might become straight. The lingual artery arises again within the carotid triangle, passes toward the submandibular triangle, and then pass deep to the hyoglossus muscle. This here, it has been removed, the hyoglossus. You see the artery pass deep to it. The hyoglossus is this one, and then the artery pass deep to it. The artery passing deep to the hyoglossus, and then emerge from the anterior border of the hyoglossus, ascend along its anterior border to the inferior surface of the tongue, for the supply of the tongue. As it is behind it or deep to the hyoglossus, it gives rise to the dorsal lingual artery, which supplies the posterior 1/3 of the tongue. Also gives rise to sublingual branch for the supply of sublingual salivary gland and the floor of the oral cavity, and continues on the deep surface of the anterior 2/3 of the tongue as the deep lingual artery, supplying the tongue. So the lingual artery is the main supply for the tongue and the floor of the oral cavity, with the sublingual salivary gland, which lies in the floor of the oral cavity. This is the second branch, so superior thyroid and lingual artery. Next, we have the facial artery. The third one is the facial artery, arises above the lingual artery, or sometimes both of them arise by one trunk and then divide into lingual and facial artery. The facial artery, again, we have studied it with the face, arises again from the medial aspects of the external carotid artery, enter in the submandibular triangle deep to the posterior belly of the gastric, and then pass deep to the submandibular salivary gland, and then emerge. Here you see it passes behind the mandible, lies so over the submandibular fossa of the mandible, and then emerge at the base of the mandible, anterior to the masseter, and ascend into the face over the mandible, then toward the angle of the mouth, ascend upward until it reaches to the angle, medial angle of the eye on the face, reaching to medial angle where terminate as angular artery. The facial artery so has a cervical course, a course in the neck, and a facial course in the face. You can feel the pulsations of facial artery here just at this point over the base of the mandible anterior to the masseter. If you clench your teeth, the masseter will stand up, and then anterior to the masseter. You can feel the pulsations and roll the facial artery under your index finger over the base of the mandible. The facial artery within the, here is the facial artery which is cut now. In the neck, cervical part of it, it gives rise to glandular branch for the supply of submandibular salivary gland, and gives rise also to submental branch which pass to the submental triangle, supplying floor of the oral cavity, that is the mylohyoid muscle from the inferior aspect, and then it ascends into the face. In the face, it gives rise to a branch to the lower lip, which is called inferior labial, which is this one, pass toward the inferior to the lower lip, and then gives rise to another labial branch, upper labial, to the upper lip, passing inside the upper lip, and then ascending into the neck. It gives rise a branch to the nose. It's called lateral nasal branch, lateral nasal, and then terminates at the medial angle of the eye by anastomosing with the branch of the ophthalmic artery supplying the face. So the facial artery, this is the third one, passing upward, reaching till the medial angle of the eye. Again, the facial artery, you see it has a tortuous course. This again to allow for the, because movements of the mandible again stretch the artery, so to prevent injury to the artery during movement. It has this tortuous course, so it allows for this elongated course for the movements of the mandible. So the same thing, just like for the lingual tortuous artery and the facial also, it has a tortuous course. It's not straight artery. You see, it says, look, this is to allow for movements of the mandible. This is the third branch. Now next, from the posterior aspect of the internal thoracic artery, which is not seen, it gives rise to another branch which is called the ascending pharyngeal artery. The ascending pharyngeal artery, from its name, is the main supply for the pharynx. We have studied with the pharynx. It ascends upward to pass above the superior constrictor muscle and then enters inside the pharynx. It gives rise to branch for the palatine tonsil and for the supply of the soft palate. The ascending pharyngeal arises here, but opposite usually the superior thyroid artery, and then ascend on the lateral wall of the pharynx toward the superior constrictor to enter inside the pharynx above the superior constrictor, supplying the walls of the pharynx, partly soft palate, and gives rise to a tonsillar branch. So here now we have 4 branches of this external carotid artery ascending behind the neck of the mandible. It gives rise to another branch which is the occipital artery. From the posterior aspect, just as it passes behind the angle of the mandible, the occipital artery passes backward in a groove over the mastoid process and then along the superior nuchal line, or it anastomoses with its fellow at the external occipital protuberance. It gives rise for occipital branch, which supplies the skin of the skull, posterior aspect of the skull, and gives rise to a descending branch which anastomosis with ascending branch of deep cervical artery for the supply of the muscles of the back of the neck. So this is the occipital artery arising again from the posterior aspect of external carotid as it passes behind angle of the mandible and then passes in the groove in the mastoid process and then until it reaches to the external occipital protuberance below the superior nuchal line. Anastomosis phalloid supplies the scalp, posterior aspect of the scalp, and gives rise to a descending branch for the supply of the muscles of the back of the neck. Now then, the external carotid artery gives rise before it enters into the parotid gland. Before it enters into parotid, it gives rise to another branch from this posterior aspect, which is the posterior auricular artery. We have studied this with the auricle. The posterior auricular artery, from its name, passes behind the neck of behind the auricle of the ear, of the external ear, supplying the auricle and skin of the scalp again over the temple. So now we have superior thyroid, lingual, facial, ascending pharyngeal, occipital, posterior auricular. 6 branches arising from the external carotid artery, and then it enters inside the parotid gland. Within the parotid gland, it divides into 2 terminal branches, divides into maxillary artery and superficial temporal artery. So again, external carotid artery is the main supply for most of the neck, face, scalp. Gives rise, as I say, to 6 branches before it passes into the parotid gland. First branch is superior thyroid artery, arises from medial aspect, descend to superior pole of thyroid gland. Supplying it gives rise to infrahyoid branch, sternocleidomastoid, superior laryngeal and cricothyroid branch for the supply of the larynx. Next, ascending pharyngeal is the smallest branch arising posteriorly near origin of external carotid, ascends between it and internal carotid and pharynx to cranial base, where it enters inside above superior constrictor, gives rise to pharyngeal branch for the tympanic cavity, and meningeal branch, and tonsillar branch. Third, you have lingual arteries, chief supply to the tongue and floor of oral cavity, arises anteromedially between superior thyroid and facial, level of greater horn of hyoid bone, supplies suprahyoid to the hyoid bone, dorsal lingual and sublingual for the sublingual salivary gland, and then it continues as deep lingual artery for the supply of the tongue. Fourth, you have the facial. This arises again within the carotid triangle, just above lingual, or sometimes in a common trunk with it. Medial to the mandibular ramus, it arcs upward and grooves posterior aspects of the gland, of the submandibular gland, turns down between gland and medial pterygoid and reaching surface of mandible, curves around its base anterior to the masseter to enter the face, where you can feel it and feel its pulsations. It's cervical part of it. It gives rise to ascending palatine, submental, tonsillar, and glandular branch in the neck, and then in the face gives rise to inferior labial, superior labial, and lateral nasal, and continues as the angular artery. Number 5, we have occipital branch, arises posteriorly from external carotid, about 2 centimeters above its origin. At first, medial to posterior belly of digastric. It ends posteriorly for the supply of the scalp. It gives rise branch to sternocleidomastoid, to mastoid, stylomastoid, auricular branch, and muscular descending for the muscles of the back of the neck. Number 6, posterior auricular, from its name, small branch arising posteriorly above the digastric and styloid process. ascend between parotid and styloid process to groove between mastoid and auricle, divide into auricular and occipital branch. Stylomastoid branch passes through stylomastoid foramen. Then the external carotid artery divides into two terminal branches, as I said, within the parotid gland. These are the superficial, temporal, and the maxillary branch. Now the superficial temporal artery, we have studied this with the face. It emerges from the superior pole of the parotid gland, ascend upward, anterior to the auricle, and then divides into frontal and temporal branches for the supply of the skin of the scalp. We have studied with the supply of the face. It gives rise to transverse facial artery, which passes transversely and anastomoses with the facial artery. It gives rise to glandular branch for the parotid gland, and also gives auricular branch, and the branch for the external acoustic meatus, and then divides into frontal and temporal branch. This is for the first or the smallest of the two terminal branches of the external carotid. Superficial temporal, smaller, begins in parotid gland, behind mandibles, neck, crosses posterior root of zygomatic and pulse 5 centimeters above it, divides into frontal and parietal branch for the supply of skull. Gives transverse facial, auricular branch, zygomatic-orbital, and temporal and terminal frontal and parietal branch. Now, lastly, we have the maxillary artery. The maxillary artery is complicated, but the maxillary artery is the largest of the two terminal branches of the external carotid, arising within the parotid gland, and then passes from there into infratemporal fossa, and then leaves the infratemporal fossa through the pterygomaxillary fissure to enter into the pterygopalatine fossa, where it divides there into terminal branch. Now, the maxillary artery is the main supply for the whole oral cavity. Supplies the roof of the oral cavity, supplies the upper teeth, the upper alveolar arch, supplies the mandible, the lower teeth and the lower alveolar arch, supplies roof of the oral cavity, except we have seen that the floor of the oral cavity is supplied by the lingual artery. The rest of the oral cavity, all it's supplied by maxillary artery, including the roof, the alveolar arch, all upper and lower teeth. Also, it supplies the nasal cavity, the floor of the orbital cavity, the maxillary sinus. All these are supplied by maxillary artery together with the nasopharynx. So it has an extensive supply. It's an important artery. Artery injury to this artery within the parotid gland, it leads to loss of blood supply of a lot of areas, that is half of the upper, above the roof of the oral cavity, the upper alveolar arch, upper teeth, and lower teeth with the mandible together with the nasopharynx. So all these areas are supplied by the maxillary artery. It's divided, the maxillary artery, according to its course, into three parts. Here is the maxillary artery, which is not shown here because it passes deep. And then only here is its first part. The other two parts, they pass inside the infratemporal fossa and the pterygopalatine fossa. The first part of it The first part is the one which is the so the maxillary, the largest of the two terminal branches, arise within parotid behind mandibular neck, passes medial to neck, superficial or deep to the lateral pterygoid to pass through the pterygomaxillary fissure to enter pterygopalatine fossa. So throughout its course, within the parotid gland behind the mandibular neck and medial to neck, this is the first part of it. Then it passes into infratemporal fossa, either superficial or deep to the lateral pterygoid muscle. This is its second part. Then it leaves the infratemporal fossa by passing through the pterygomaxillary fissure to enter into pterygopalatine fossa. So the first part of it, 3 parts, is called mandibular. This is related to the neck of the mandible. This lies between mandible's neck and pterygomaxillary fissure. It gives rise to 5 branches. These are the deep auricular, which passes to the external acoustic meatus, anterior tympanic for the supply of middle ear cavity, middle meningeal and accessory meningeal artery, and inferior alveolar artery. The middle meningeal enters through the foramen spinosum into the cranial cavity for the supply of the meninges of the brain. Accessory middle meningeal, again from its name, accessory, because sometimes is not present. It passes through the foramen ovale with the mandibular nerve, enters again in cranial cavity for the supply of meninges, and then finally it gives rise to the inferior alveolar. The inferior alveolar, this is the supply for the inferior or lower teeth. The lower teeth, the inferior alveolar descend through the mandibular foramen, pass inside the mandible and supplies all the teeth, and then emerge as the mental branch from the mental foramen. Next, the second part of it. This is called the pterygoid because it passes superficial or deep to the lateral pterygoid muscle within the infratemporal fossa. This gives rise to branch till the pterygomaxillary fissure, gives branch we are called muscular branch for the supply of muscles of mastication. It gives 2 to 3 deep temporal branch which pass upward deep to the temporalis muscle supplying it. 1 or 2 masseteric branch which pass above the mandibular notch to enter deep to the masseter supplying it, and the pterygoid branch for the lateral pterygoid and medial pterygoid muscles. So it supplies all 4 muscles of mastication, and then gives rise to another buccal branch which becomes superficial for the supply of the skin of the cheek, that is on the lateral side of the face. So mostly this is muscular, gives rise to 4 muscular branches for the temporalis muscle, for the masseter, for the lateral and medial pterygoid muscles, and then gives rise to buccal branch for the supply of the skin of the face on the lateral side, that of the cheek. Then from here it enters through the pterygomaxillary fissure to become the pterygopalatine part. This lies within the pterygopalatine fossa. Within the pterygopalatine fossa gives rise to a lot of branches. Here it supplies the nasopharynx, floor of the orbital cavity, maxillary sinus, nasal cavity, roof of the oral cavity, and all upper teeth, the upper alveolar arch, and all upper teeth. So it gives rise to posterior superior alveolar, partly for the supply of the teeth, infraorbital for the floor of the oral cavity and emerge on the face, and then greater or descending palatine, lesser palatine for the roof of the oral cavity, pharyngeal branch for the nasopharynx, artery of pterygoid canal, this pass supply the partly the meninges, and sphenopalatine for the supply of the nasal cavity. So the maxillary artery is the main supply of roof of the oral cavity, which means together with the superior alveolar arch or upper alveolar arch and all upper teeth, maxillary sinus, floor of the orbital cavity, nasopharynx, the hard palate and partly the soft palate, and then supplies also the nasal cavity. The nasal cavity with all upper teeth. Then next it supplies the mandible and all lower teeth. It gives also branch for the supply of the skin of the face through the infraorbital branch of it, which emerges at infraorbital foramen, dividing into palpebral, labial, and nasal branch. And then as the mental branch, it supplies skin over cheek, and the buccal branch also of a supply of the lateral aspect of the cheek. So this is for the maxillary artery. Now we have seen that the external carotid artery supplies most of the structures in the head and neck, supplying the thyroid, the larynx, the pharynx. Within the neck, the submandibular gland, the muscles, the infrahyoid and suprahyoid muscles, and then supplying most of the skin of the face, the scalp, the auricle, and then supplies floor of the orbital cavity, nasal cavity, all the oral cavity with all its content, and the nasopharynx. So it's the main supply for all head and neck, except that in the face, if you remember from the face, we had branch of ophthalmic artery, which arises inside the cranial cavity as branch of internal carotid, supplying 5 branches for the skin of the face and scalp, the supraorbital, supratrochlear, lateral palpebral, external nasal, and the infratrochlear branch. These are from the ophthalmic for the supplying of the skin of the scalp and face. Otherwise, the rest of the head and neck all is supplied by the external carotid artery. I'll stop here today. Next week, we will study the details of the blood supply of the alveolar arch, that is the teeth. It is because very important for you as a dentist. I'll stop here today. If you have any questions, do you have any questions? Anybody? Anybody؟ ما حد عنده سؤال؟ لو كلكم ما موجودين ورايحين. إسراء؟ إسراء, are you there? أحمد محمد عبد الله؟
شكرا دكتور.
موجودين. ما عندكم سؤال؟ Next week we will study in detail the blood supply of the alveolar arch of the upper teeth and the lower teeth with the roof of the oral cavity in detail. Since this is very important for you when you become dentist, you should know the supply of each tooth so that you can be careful in doing processing over the teeth or over the mandible and the maxilla. If you don't have questions, بالامتحان كنتم مو زينين؟ زو خرابون؟ لو؟ كلش مو زينين بالامتحان؟ نعم؟ Who raised his hand? ما كنتوا زينين؟ ما حد عنده جواب؟ ليش ما كنتوا زينين؟ ماكو جواب منكم، شو اسوي لكم؟ If you don't have any questions, then you can leave. You will come to the end today. And next week we will study, as I said, the blood supply in detail. That is mainly the maxillary artery. It's a group. Yusuf, Abdullah, Firas, Osun. Do you have any questions?